I'm joined by Denise Foreman, who's an assistant to the county manager. She's here to talk about changes that have occurred in the behavioral health system. Welcome, Denise.
Thank you.
First, can you share with us why there's a need for changes and what some of those changes are?
In the last 10 years, the state of North Carolina has been working through mental health reform, and we have more recent versions of legislation that requires that we manage and provide our services differently across the state of North Carolina. The most recent change became effective on July 1st for us. We created a multi-county LME with Durham County, and the creation of that LME has presented a conflict of interest for us so that we have to provide our services differently.
UNC Health Care is part of this partnership, and what is their role?
We're so excited to have them at the table with us. We've actually been working with UNC Health Care for several years, but last fall we entered a partnership with them and the state of North Carolina to have a study done to evaluate the programs and services in Wake County and determine some needs and gaps that existed and any potential opportunities for UNC Health Care to come and help fill some of the needs and gaps. So we finished that study in the spring, which aligned with our formation of Alliance Behavioral Health Care. So they ended up partnering the study with us and helping us. A lot of these changes ended up all coming at the same time, which was pretty exciting, actually, a little scary, but exciting at the same time. We had the results of this study that identified some needs and gaps. We created Alliance Behavioral Health Care, and in the creation of Alliance Behavioral Health Care, we developed a conflict of interest for Wake County because Alliance is managing funds for services that are provided by Wake County, and we can't do that. It will be in conflict with Medicaid laws, and so we can't do that. So Wake County actually has to get out of the business of being a provider of services for behavioral health care. So we had the study, we have a willing partner in UNC Health Care, and we had changes in law that require us to do the businesses that we do differently. So UNC has agreed to step up and help us out, and they're going to take on the services that we're currently providing at our Wakebrook campus, which include facility-based crisis. We do detox, rehabilitation services, and then UNC Health Care is going to also step up and open 16 inpatient psychiatric beds to help fill a critical need in the community that's causing long wait times in our crisis and in our emergency departments. So they came to the table over a year ago, and it's taken a little time to evolve and figure out the appropriate role for them, but we're certainly excited that they're here.
For folks at home that are wondering how these changes affect them, what are some of the information that they might need to know?
A number of changes will be transparent. Citizens won't feel a thing, but others may, as we move through the evolution of the transition of services, others may become more apparent. We may have to move some services from a facility to another as we find providers, and the providers are in different locations. So residents may find that they are seeking services in different locations, and others will be exactly as they appear now. They will just be provided by different providers, and so they may present themselves at one of our facilities and may be treated by someone different than they would have a year ago, but they largely will not know that. So most of the services that are being provided to our residents today will continue to be provided in the future, but they may be provided in different locations or by different staff. Or they may be provided by the same folks in the same place. As we work through this transition over the course of the next 6 months or so, we'll find out more information how those transitions will occur. But right now we anticipate much of it will look largely the same.
How can residents find out more about the changes as they're occurring?
We've established a website, bhp.wakegov.com. And on this website, we have provided a lot of information for residents, businesses, doctors, many folks to be able to find information to help them as the transitions continue. We've got studies and research that we have done. So we've got a section with documents that are great information of evaluations that have occurred. And then we have our ongoing evaluation of the programs and services with regular weekly updates as our group of stakeholders work through the evaluation of our programs, make recommendations for programs moving forward. And then as we develop our recommended plan and our approved plan, we'll include all of that on the website moving forward.
Well, thank you for being with us. Is there anything else that you'd like to add before we go?
Just to encourage folks to stay with the website. The website will be updated on a regular basis and will be the most accurate source of information for folks.
Thank you so much again for being here today. We appreciate your time.
Thank you.